Hi, I had a question recently about modifications for if you have knee pain in Warrior Two, specifically when your when the knee pain happens in the back leg, the straight leg in Warrior Two. This happens a lot with meniscal injury or just after knee surgery, and I've had experienced a lot of problems with this myself. So the first thing that you do, and especially if you're in the initial stages of healing, or if no matter what you do, that position hurts, you can modify your Warrior Two by taking the back knee down, spinning it, and coming up to Warrior Two kneeling. It's really easy to do in the context of a flow, and so this has been a really nice way that's worked for me pretty well. If you don't like taking your back knee down quite so far, you can put a block under it and then do a little turn. Depends on how comfortable you are with your knee on the block, how squishy your block is, but sometimes that's a nice way too, so you don't have to get your knee down as far. And if you can't lower your knee, you come all the way down, step, and spin. This is what I did for a long time when I was a little earlier on in my rehab, and Warrior Two was just not going to happen. So give that a try and see what you think. Hey, this is part 2 of my what to do if your back knee in Warrior Two is painful. Especially if you've had a meniscal injury or knee surgery and you find that when your leg is in the back in Warrior Two, it's really painful. So part 1, I showed how to just totally modify it and take the back leg basically out of the equation. But if you, for instance, can stand in a fairly wide-legged stance, you know, even if it's a little shortened, that's fine, and it feels okay, but then when you start to go into Warrior Two, you get pain. I have a couple of tips for you. The first one is you can certainly shorten your stance and make it a little shorter, but if you're trying to progress a little bit in your Warrior Two and getting stuck, the first thing that I do is take the front foot and heel toe it in the direction of like my toes of my back foot. So I actually have my heel a tiny bit in front of my toes alignment wise now. And I find that that has made a big difference for me and been really helpful in making my back knee less painful. And you might also notice that I've got a little bit of this pelvic tilt. So you can tilt your pelvis a little bit, and basically what it does is it takes some of the stretch off of the inner thigh in the back, and you get a little less of that pain in the knee. So you can start that way, but then you want to start progressing back to a more neutral pelvis so you can deepen the pose. So you can start to, it's almost like you're pushing your pelvis in the direction of your front knee. And so as you do this, you can start to do it, and then you might say, ooh, okay, that's where I need to stop and back off so it's pain-free. And then you work on holding a pain-free position, and then you progress. So as your body gets used to that, you might be able to push it a little bit more forward. The key is pain-free. If you have a meniscal injury or you're post-op, you don't need to be pushing through the pain in this particular pose in Warrior Two. So make sure that whatever you're doing, you're working slowly with your body to try and work your way into a deeper Warrior Two that is not painful. Give that a try. Let me know what you think.